Hi, gang. This is Dr. Echols back again. Welcome to part 2 with Miss Melissa. In part 1, we helped her strengthen her psoas muscle, which is really the foundation for your back. We've just got to get that working before we go any further at all. And we got that thing working so solid. I think when she almost threw me through to the ceiling with that muscle. She's very strong, but when these muscles are turned off, even though they're just not going to work properly because they're not hooked up to the body. So we're going to kind of proceed and find out if we can find out any other muscles that are weak, and those muscles will help lead us to where the issues are. Are you ready to get started?
Yes, sir.
Okay, let's lay down on your back for me. And the first muscle that we checked, in case you didn't see the first video, was the psoas muscle. Push up for me right here. And this was the one that was real weak with her. Push up here. And now it's rock solid. Very important muscle to check. Push up. Very good. The next muscle we're going to check is called the tensor fasciae lata. And people oftentimes refer to this as the iliotibial band. It's right through here. And you'll push out and up while your foot's turned in. Push out and up. And that muscle locks in place really nicely. So we don't have any problems with that. Push out here for me. And that one works really good too. So the next muscle we're going to check is called the rectus femoris, and this is one of the muscles right through here, and it is one of the main hip flexors here. Raise your leg straight up and push straight up, and nothing happens. It is just completely weak. What happens, Melissa?
It didn't move.
It just doesn't work. Now when we try this one, push up, it works just fine. Can you feel the difference? Absolutely, big difference. Push this up, I can take one finger and I can just push this muscle straight down. It's very, very weak. Okay, so instead of stopping right here, let's go on and check a few other muscles and let's see what we find. So one of the quick ways we can check the gluteus maximus, which is your butt muscle right here, is by just having them push straight down into the table, push, and that locks real good. Push down here. And that one just does good. The anterior tibialis is a muscle that is intimately connected to the lower back, and we test that by having you pull your foot up, your toes. Don't let me pull them down. Real strong and real solid. You'll find that these muscles are very strong because they're holding up all of your weight here. They're very strong. The gluteus medius is another muscle that we can check that has to do with it's in the rear end area and the hip area. You'll turn your foot out like this, and what I'm going to do is push out. Don't let me push out, and that works great. And push out here, and those work wonderfully. Now we're going to check the adductor magnus by having her pull in. This is one of the muscles on the inside of her leg here that helps pull in the leg or adduct it. Pull in. See, wait a minute. Pull in. There we go. See, she was wanting to cheat on me a little bit. Did you feel that?
I did.
You were wanting to cheat a little bit. So the adductor magnus on that right side is not really working that great. Okay, let's check the iliacus. Push straight up for me. Nothing. Push straight up here, and that one works perfect. So we've got several muscles on this side that aren't working. Normally I'd be writing all these down, but we're just going to wing it today. All right. Next thing I want to check is the piriformis muscles. And these are also muscles in your rear end, and they hook into the hip area here. And Alyssa, what you're going to do is push in this way for me. Push like that. And that is rock solid. Now we're going to have her put her foot onto the table like this, and we're going to rotate her foot in, and then I'm going to pull out, and you try to keep me from pulling out. This is a muscle, the popliteus muscle is a muscle that runs in the back of the knee here and around and hooks in, and this muscle is what stabilizes the knee. So when I see patients with this that are weak and they're running, I actually ask them to stop running until I can fix it. Because normally you have the bones of the knee come together like this, and they are supposed to, be stable and moving. Without that muscle working properly, they're actually kind of doing this, which can cause a lot of knee injuries in there. But not to worry, yours are fine, at least this one. Now bend here and push in this way. And that's rock solid. Put your foot here, turn it in, don't let me pull it out, and that one's rock solid too. All right. So we had the rectus femoris here, iliacus, I think that's what we'll, and the adductor magnus over here. That's right, very good. So where to start with you? I think we'll start with this rectus femoris over here and see if we can correct that. You mentioned that your sacroiliac goes out a lot of times. Oftentimes this muscle is directly related to the sacrum, so it can, and it can cause those problems. So first of all, let's get back to this position here. We're going to use this as an indicator muscle. And we're going to get push. Okay, and we're going to go down here. Open your eyes. Close your eyes. There we go. Perfect. Now let's see what we find. Before we do that, it's nice to have the book. There's about 1 billion different points and muscles and connections, and I'm getting to where I can know a lot of them, but I like to have that backup every once in a while just to check myself out and make sure I'm not missing anything or doing the wrong point. Okay, so now there's going to be a little spot that might be tender right there. Is that correct? This is a neurolymphatic point. It's kind of like an acupressure point, and she's feeling the other point here too. And I'm down here on the insertion of the rectus femoris, and you'll notice that I have a finger above the kneecap and below the kneecap because it almost kind of inserts in both places. So we're not taking any chances on that. That get your attention, Melissa? Yeah, I did. I think it did.
This one's not too big.
But down here. Okay, good. It's interesting to note, too, that a lot of athletes love this kind of work because, unfortunately, I hate to use the word unfortunately, but the way our bodies work is that, you know, they got to be about 80%, something's got to be about 80% broke before the symptom actually shows up. And what I mean by that, if you look at cancers, for instance, by the time you know you've got cancer, it's been there for years, at least 10 years, maybe more. By the time you know you have heart disease, you've had it for many, many years. Diabetes, same way. So even with musculoskeletal problems, unless it's some kind of a trauma, these problems can have been there for quite some time before they actually start showing up. With applied kinesiology and checking these muscles, we can find problems long before they become symptomatic to you, the patient, which is very beneficial for anybody, but especially for athletes because they may injure themselves if that muscle isn't working properly. They're putting their bodies under so much stress. But even for non-athletes, it's real nice to make sure your body's working the way it's supposed to. I see a lot of patients who they'll start working out. They want to get in shape. They're trying to do the right thing. They go to the gym. They don't realize they've got 15 muscles in their body that aren't even working properly. So they go to the gym, and when they start working out, what happens? Of course, they injure themselves right off the bat. So it's always good to go in and get everything working first before you go in and start doing those exercises. Okay. So we've got T3 or the posterior sacrum. So you have a vertebra in your upper back that's out of place that's actually related to this muscle.
Cool. Not that it's out of place, but cool.
Exactly. And you've heard me say it before if you've watched any of my videos. I have the cutest little miniature dachshund at home. His name is Yoda. Love that boy to death. But if I accidentally step on his tail, it's the other end of him that barks. So she's got some barking going on down here, but the problem is way up here. And that's one of the hardest things to get across to patients is that they come in and they've got a pain somewhere in their body, and we start working on the other end of their body, and they go, no, you don't understand, doctor. The problem's down here. I'm like, well, the pain is here, but not necessarily the problem. So today, we've got problems down or pain down in here, this area, but she's having a problem up here that's directly related to it. So I'm going to get you to lay face down. You can use that head cut face. Yeah, there we go. And this is the T3 vertebra. And we're going to adjust it on the left. Get yourself all fixed up. All right, 1, 2, 3. Breathe out for me there. Atta girl. Perfect. Wow. That was a good one, wasn't it, Melissa? You did that great. Whenever you can move again, just go ahead and lay on your back for me. Okay. All right. So in relationship to this muscle here that's not working, we found several acupuncture points that are needed to be stimulated. Now, the first vertebra that we found is way up here in her thoracic spine, and that moved beautifully. We'll see what the next thing is. It's a muscle acupressure point. And this one is going to be here on your arm right. Is that tender there?
A little.
Let's find where it's really tender.
You're getting close.
Getting close.
Yeah.
Right. Let's see if I'm on. Yes.
Yeah, right there.
Right here? Okay. So right here, this is the muscle acupressure point that I'm holding here. And then we're just going to get on the muscle itself. Pretty tender there? Yeah. And again, we'll kind of get these guys talking to one another. It's almost like they stop talking to one another for some reason. Kind of like when a circuit breaks in the house, it stops the flow of electricity to the refrigerator. Well, this does the same thing. And by doing this, we get these back into communication with one another and problem solved. Oftentimes, just holding these points, the patient will find it after the initial discomfort of having the point stimulated, the person will go, hey, they don't even hurt anymore. And I'm starting to feel pretty relaxed. All right, wake up. Here we go. That's another really important thing is the patients oftentimes get so relaxed on the table, I have to kind of like get them back with me because it takes two to do this. I can't do it all by myself. So I've said, come on, because they'll just like, oh, leave me alone. I'm about to sleep. That's right. Okay, I believe that's showing up. So put your arm here. And it's going to be a little tender there. Yeah. Yeah. I know the spots. This is where the rectus femoris inserts into the pelvis. And with her, it's pretty tender there. And we're coupling it with this point right here on her head, right about where the hairline is. It's under a vascular point. And we're just connecting these together. How's that feeling down there now? Pretty better?
Yeah, a lot better.
Okay. I'm feeling the pulses pretty well. Oftentimes the patient will tell you it's really kind of stopped hurting. That's about the time we start to feel the pulsing. So you know you're done with that point. So every once in a while, I'll just kind of check and I'll push here and to see if the patient's with me. And she's gone to sleep. So we're going to wake her up again and ask her to come up to present time and give me a little bit of resistance there. There you go. Perfect. Good. Very good. Now you're working. So your sacrum needs adjusting. Okay? And the sacrum is right below the last vertebra. It's that big broad bone that's just kind of right in your back. I'll show it to you when she flips over. Go ahead and roll this way, facing me. Okay, so we're going to get her to scoot over this way a little bit. You all right?
Just when you lean down, sometimes my thigh gets squashed against the edge of the table.
Okay, scoot more this way then, so it doesn't do that. Okay. Is that better? Thank you for telling me that. You got to make sure the patient's comfortable. That's very important. So the sacrum is a very broad bone that goes across the lower portion of the spine here, and it kind of goes like this in this kind of a shape, and then it ends in the tailbone right here. Her sacrum is rocked back posterior or back this way on this side. And you'll ask people with lower back pain, they'll often have pain right in this area. That's where they'll point to, and that's where she's having trouble. So breathe out. Air starts to go already. How's that leg? Is that hurting?
Yeah, it's fine.
Okay, good. And there it goes. Good job, Melissa.
Thank you.
All right. All right. Let her catch her breath. Good job. Let's back to work. That's enough. All right, push here for me. Okay. Sorry. Put both fingers right here for me. This one and this one. Now, oftentimes we find that problems can, any kind of problem in your body can come from 3 different areas or vectors if you want to. Of course, it can come from mechanical problems like we've been seeing. But it can also come from chemical problems that we've been seeing too. Somebody needs a vitamin. That can make a muscle weak. Somebody's got heavy metal toxicities. That can make a muscle weak. Somebody's being exposed to some sort of toxin in their house, or they're eating wheat when they shouldn't be. That can do it. But also emotional charges that we just kind of shove down in our body can also cause muscles to weaken out. And with Applied Kinesiology, we have that as one of our tools to help clear those emotional blockages out as well, and makes a big difference for the patient. Put your fingers right back there for me. That a girl. Push in there a little bit. Good. I usually have some music going in my office to help me keep rhythm, but I don't have any here today, so I'm just going to carry on the best I can with my bad rhythm. And these are just acupressure points that we are finding that correspond to the organ that we're working with. Put your fingers right back there again. Good. And each organ has its own special emotion that it's kind of harbors, if you will. And right now we are working on Miss Melissa's gallbladder. Good. Okay. Now, you have also got a bone in your foot that's a little bit out of place. It's your fourth distal phalanx, so we are just going to adjust that before you even know what happened. Nothing too big about that. And now we're back to yin. Her arm will go weak, and let's see if that muscle is better. Push up for me real hard, and I cannot push it down.
So cool.
So that was wonderful. You did great.
Thank you.
So what we did was, we know that she's been having some occasional lower back pain that has been coming and going. And she even told me, I think, that it had been hurting over her sacroiliac joint. So we went ahead and tested some muscles. Of course, on the last video, we found that the psoas muscle was weak, and we corrected that. On this video, we found several muscles that were weak, but we chose to work with this rectus femoris muscle first, which is one of the main flexors of the hip. And it was so weak, she really couldn't even hardly hold it up at all. Then we went and found everything in her body that was causing it to be weak. We found several acupressure, acupuncture points that were needed to be stimulated. We also found that she had an L4 vertebra that was out of place, and we adjusted that. And then we also adjusted, no, that's not right. We did the T3 vertebra that was out of place. That's way up here in her spine. We adjusted that. We found out we had still more to do, and we found that her sacrum was out of place. So we adjusted the sacrum. The muscle was still showing that there was something to do. Then her foot turned up, and we adjusted her foot, and that cleared the whole problem when we did that. Oh, and she also had some stuff with the organs that showed up, and we went ahead and cleared all of that out too. Once everything showed that it was fixed, then all we had to do was retest the muscle, and fortunately now she could probably kick my butt if she wanted to, because it's pretty strong muscle now, which is fun. So that's one of the ways that we go about, finding out exactly where these problems are so we can correct them and they don't keep coming back over and over and over again. Thank you so much for watching. Please, if you have any questions or you need some help, please contact me at the email below or give me a call. We get lots of calls and emails. I'll get to you as soon as I can. We are in Austin, Texas, so if you'd like to come see us, we roll out the red carpet for you and help you any way we can. As far as being other people at other places doing what I do, I really don't know of anybody. So I would just recommend that you Google Applied Kinesiology and see if you can find out somebody that could help you in your area. If you can't, come on down to Austin. It's a little hot this time of year in the summer, but hey, it's still a lot of fun. Music capital of the world. We'd love to see you. Thanks again for watching. Check you next time.